Hello everyone, I'm Dr. Lori Langdon, board certified pediatrician fellow of the American Academy of Pediatrics, here with a follow-up video from Sunscreen to talk about sunburn. What if you missed it? What if you were out for too long between the hours of 10 a.m. and 4 p.m.? What if the sunlight was reflected off the water or the sand or the snow and you got sunburned? So most sunburns are mild, and usually it's where you missed a spot with the sunscreen, or your shirt didn't cover an area that it usually covered, and you had untanned skin exposed to sunlight for extended periods. It can be very painful. It can be bright red. It can even have blisters on it, and the severity depends on how much of your body is covered in it and how long that skin was exposed. So let's do everything we can to prevent it. Avoid being out from 10 to 4. Keep everything covered, or at least covered in sunscreen. Remember to reapply. Remember that you can still get burned on cloudy days. Remember that tanning in a tanning bed, while it can increase your risk for skin cancers, does not prepare you for being in sun for too long and does not mean that you don't need to use sunscreen. So please try to prevent it. But if it's too late and you've got sunburn or your child has sunburn, here are some tips. First, get in. Don't let any further burn happen. Once you've already noticed it's pink, it's very late in the process because the amount of swelling, redness, inflammation, and pain only increases. You initially start to even realize it only 3 to 5 hours sometimes after the sun exposure, and then that inflammation continues to build. You know, there are all these inflammatory cascades that happen in our body and these complex systems, and so we want to try to break some of those if we can. So absolutely get in out of the sun once you realize you may have been burned. Cool off your body. Get into some air conditioning. Take a lukewarm or cool shower. Use cold, wet washcloths or compresses on your skin. Use aloe-based gels. Some of them over the counter even have some pain medicine in those gels that you can use. Use by mouth something like ibuprofen or Aleve, a non-steroidal anti-inflammatory drug. You can even, if the skin is not broken, you can even use hydrocortisone cream on a burn, but never on broken skin, of course. Just a little bit to take some of that redness and swelling out is fine. Remember that these areas can be very puffy, so you want to wear some loose fitting clothes so it doesn't press down on those painful areas. Now, every now and then a sunburn can be so extreme because it covers such a large part of the body, or because the patient is having shaking, chills, or unable to drink fluids, or dehydrated, or vomiting. They may actually need IV fluids, and in extreme cases, even IV pain management. So there are some extreme cases of sunburn. Hopefully you will never get one of those. And the reason we want to prevent these bad cases is we know that sunburns increase the risk for skin cancer. All forms of skin cancer. Many of them can be treated easily, but some of them are much more serious, like melanoma. So it matters a lot to prevent burns, especially childhood burns. Children are more susceptible to getting sunburned. And of course, anyone with a decreased amount of pigment is more susceptible. Now, I have seen plenty of patients and have friends who have some pigment, and yet they can also be burned. So please don't be fooled just because you're not pasty white. You can also get sunburn, so please be careful and keep your risk of skin cancer down. Also, even if you're not so worried about skin cancer, and you should be, just think about cosmetic reasons. Sun overexposure increases wrinkles, so you're just going to look more old if you over tan and over sun. I hope this was helpful for you guys. So aloe-based gels, pain gels, oral ibuprofen, rest, cold compresses, and try to prevent it. That's the important part, especially in children. Thanks.